On stage, we have Dr. Chang Chok Kwan, Head of Communicable Disease Branch Center for Health Protection, and Dr. Lau Kai Hin, Chief Manager from Hospital Authority. The two doctors will report to us the situation of the HA and the latest figures. Dr. Lau, good afternoon. Let me update you on the situation with HA. We have 2,667 confirmed patients. 350 of them are newly confirmed patients. Those who required isolation facilities, 506 are in isolation wards, 163 patients in second-tier isolation wards, 650 in Infection Control Center of North Lantau Hospital, 210 patients in AWE COVID Treatment Center. 235 of them are newly confirmed patients. Yesterday, we reported another 6 cases in critical condition, 9 in serious condition. Among the confirmed inpatients, 48 are in critical condition and 54 in serious condition. 13 of the critical patients are receiving ICU treatment. Cases of death. We reported another 8 cases of death, 7 men and 1 male aged between 57 and 92. 3 of the disease had not had 3 jabs of vaccines. 1 had never been vaccinated. An analysis of the 8 cases of death. 2, when on arrival to A&E department, had no vital signs and passed away on resuscitation. 1 of them is an 82-year-old male, never vaccinated. He had diabetes, hypertension, but he had chosen not to go for follow-up. On the 22nd of August, he tested positive by RAT. He did not report his case to the Department of Health. He had not seen any doctor or seek medication. And then on the 1st of September, his family found that he had fainted at home. They called the ambulance, and resuscitation was given on arrival of the ambulance man. And when he arrived at A&E department of Two Moon Hospital, he had no heartbeat shown on EEG, and then resuscitation was given to no avail. He passed away at the A&E department of Two Moon Hospital. The A&E department there tested him with RAT positive, and PCR CT value was 19.5. That patient was never vaccinated. He had chronic diseases, and he had chosen not to follow up on his diseases. Some patients, including this one, did not report the case to the Department of Health after RAT positive. Perhaps it's because he was old. So if we have an elderly person tested positive, please report to the Department of Health's declaration, or family members should help him to do so that the Department of Health or CHP can decide whether isolation is needed, and a questionnaire survey can be conducted after declaration. And for the hospital authority, all persons over 60 years old, we will communicate them on the phone. We will check their situation and give them information on tackling COVID. We'll also see whether they have seen a doctor to get COVID oral drug. If not, we can make appointments for him at designated clinic, or give him teleconsultation so they can be prescribed the oral COVID drug to prevent the development of serious conditions or even fatality. Another one who passed away at the A&E department is a 57-year-old female. On the 27th of August, she did a PCR, was positive, and then on the 1st of September, in the morning, family members, or rather in the afternoon, family members heard him complaining of unwell, and then her speech became rather unclear. So her husband called an ambulance, and when ambulancemen arrived, she had already fainted. Resuscitation was done, but when he was sent in the department, resuscitation failed, and she passed away. She had 2 jabs of vaccines. She had cancer in her lungs and also kidneys, and her CT value was 19.6. For the remaining 4 patients, checking their medical records, their deaths might not be directly related to COVID. An 84-year-old man who had terminal colon cancer, a 69-year-old man who had colorectal cancer. His death might be related to myocardial infarction or his cancer. And then a 19-year-old man with a terminal renal failure and some other kidney condition. Another 75-year-old man also with chronic diseases. He has been treated for COVID in hospital for a while, and he developed aspiration pneumonia. Perhaps his death is related to aspiration pneumonia. Another 2 men, 87, one another 90 years old. Both had chronic diseases, including hypertension, cardio infection, anemia, and also dementia. They were admitted because of COVID. After treatment in hospital, they passed away yesterday. So patients have recovered. In the past, 302 patients have recovered. 271 of them have been discharged. We have another 10 patients found positive via admission screening, and then 13 patients in the same ward are classified as close contacts. We have another 158 staff members positive, and another 50 members of staff have returned to their posts. And 2 suspected clusters in hospital. Buddhist Hospital, a medicine ward, a patient with chronic lung diseases, 82-year-old female. Her condition deteriorated on the 30th of August. She was transferred to the Queen Elizabeth Hospital for treatment. And then the same day, she was confirmed to have COVID. She is in critical condition now. The hospital has started contact tracing, and screening was done in the ward and in the same cubicle, that is in Buddhist Hospital. 2 patients aged 88 and 101 respectively are confirmed and receiving isolation treatment. One is in stable condition and the other one is in critical or in serious condition. We are now doing further contact tracing. We have to do genome analysis before we can decide on their route of transmission. And then in Princess Margaret Hospital in a medicine and geriatric ward, a 91-year-old man on the 1st of September yesterday was tested positive through PCR. Contact tracing was conducted. 3 patients aged between 27 and 86 male patients were confirmed as well. 1 has already been discharged, and the case is being followed up by the Department of Health, or CHP. And the remaining 2 patients plus the one who tested positive are now receiving isolation treatment in stable condition. The hospital is investigating the link between those cases. Now, in Buddhist Hospital and also the ward in Princess Margaret Hospital have suspended visitations and have been thoroughly cleansed and disinfected. We'll continue to closely monitor the health conditions of patients and staff members, and we will be a liaison with CHP to keep them updated.
So the number of cases yesterday was 9,714, including 2,818 of PCR tests and 6,896 cases of RAT. 187 imported cases, among them 667 tested positive in PCR and 20 RAT positive cases. Of the 187 imported cases, 70 were identified at the airport. At the quarantine hotels and quarantine centers, 57 cases were identified. In community testing centers, cases found on the 4th and 7th days numbered 51, and on those found on the 8th to 10 days numbered 9. Of the 187 imported cases, they are from 41 places. 6 places had more than 10 imported cases, including 25 from UK, 24 from Thailand, 18 cases from Singapore and the Philippines, 15 from the US, 12 cases from India, and the remaining 35 cases imported 10 or below cases. Dr. Lau just now said that there were 8 death cases under the 5th wave. By now, number of total deaths number 9,496. For residential care homes for the elderly, several had actually reported cases. In Shamshui Padlock Residential Home, 1 resident was confirmed and 3 residents need to be quarantined. There's one Jiangsu team home for the elderly in Southern District. Over the past 3 days, 7 residents and 3 staff were confirmed. This home has 3 stories. On its 5th floor, the 26 residents living there on the 5th floor have to be quarantined. And staff there have to carry out PCR tests for 3 consecutive days. And there's also in Huai Hing, the Kwang Fuk home for the elderly. Yesterday, they reported 3 cases involving residents, and 17 other residents had to be quarantined. The New Life Association is home, has got 5 residents confirmed positive, and 5 other residents need to be quarantined. Well, today's Friday. For schools, we've got 237 schools reporting 337 positive cases, affecting 264 students and 73 teaching staff. Of the 337 positive cases, they come from 65 kindergartens and nurseries, 99 primary schools, 70 secondary schools, and 3 special schools. In the past 7 days, we've had 44 schools reporting 2 or more cases. Today, we've got some schools who need to have classes suspended. In the Central Western District Kaoyuan School, a class with 23 students, because of 3 confirmed cases in the past couple of days, this particular class has to be suspended for a week. In Taipo, a college there, 10 CL class, which has 26 students, 3 of them were confirmed positive, so the class itself has to be suspended for a week. Hangji Special School in Tuen Mun, P2 class has 7 students. It's a small class, and the students don't wear masks properly, easily, and one of them tested positive, so the whole class has to be suspended. In Chunwan, the Lokyang Kindergarten, N1A morning class has 17 students. In the past 2 days, 2 of them tested positive, so the N1A morning class has to be suspended for a week. Shenkong Hui School It's one e-class. In the past 2 days, 4 of the students and 1 teachers were confirmed, so therefore it has to be suspended for a week, that particular class. Some classes were suspended before. For example, the kindergarten in Yunlong, the NAM class and the K18 class, both classes were suspended for 1 week. In the past couple of days, is school staff and other students tested positive. Altogether, 6 groups involving 10 students and 9 teaching staff have been confirmed positive. The whole school has 242 students and 26 teaching staff. Because of the quite large number of staff and students affected, so the whole school has to be suspended for 1 week. Hip Hop Society, Shui Binwai Special Nursery, well, it has 5 students tested positive area, so it was suspended for 1 week. And this is one student group from various classes. Today, we know that there's another group in which a teaching staff was confirmed positive. So for this particular classroom, 24 students and 5 staff. Well, the whole class involving these students and staff have to be suspended for 1 week. In terms of virus strain, we expect that BA4 makes up 60.3% of the infection. If we look at the proportion of BA4 and BA5, we expect that in the community, about 53% of the infection comes from BA5, 34% comes from BA2.2, and about 7% comes from BA4, 6% comes from BA2.2.1. And yesterday I may have made a mistake. A reporter asked yesterday if a kid does not have a mobile phone, and should the young kid is asked to show a vaccine pass, well, what can they do? They can show a physical copy of the vaccination record. So now's the time for question and answers. Okay, this gentleman on the left, please. I'm from Phoenix TV. Yesterday, the new school term began. What do you think of the trend of possible outbreaks in schools? And just now you said that the vaccine pass could be extended to cover children under the age at the age of 5. But parents are worried that even if for small children to carry electronic record to the vaccine pass or physical copy, it may be inconvenient for them. So would there be any exemptions? And also, are you going to reserve isolation facilities for infected patients? What sort of facilities can we expect? Well, we see a rising number of cases still, even though today's number dropped a bit, but we're expecting the overall tally to be on the rise. So for school cases, well, they reflect the extent of infection in the community. Every day for students and staff to do a PCR test, well, in the past few months, it's proven to be effective in preventing the spread in schools or large outbreaks. Transmissions within schools are inevitable. So for individual classes in some schools or the whole school, sometimes when needed, we would recommend them to be suspended. For vaccine pass, we hope that people can get vaccinated, and we hope that it will be convenient for them. We don't want to offer too many exemptions. What's your last question? Monkeypox. I think our colleagues are discussing on arrangement for coping with monkeypox. If details are available, we'll announce them. Next question. Lady in white on the right.
HK, as a government advisor, Lau Yulong suggested that the baby version of BioNTech may not ever come to Hong Kong. Could it be true? And is the government still trying to buy them? Can you tell us the current procurement status? And also, how would you describe the proportion of pupils and staff from schools being infected? Has it been increasing? Thank you.
I understand our relevant colleagues are still liaising with the pharmaceutical company to try to buy the baby version of the BioNTech. I understand it's in progress, although we do not have an exact date of delivery. So I understand Professor Lau is, he wants to ask people not to try to delay the vaccination because the cases are increasing now, and we have observed some serious illness and death cases among the young children. So we will urge the parents to try to, go to bring their children to vaccination as soon as possible. Proportion of the school, we have not observed an obvious increase in the number of cases in the school. But we, because the community cases are increasing, and the proportion among this group should be increasing as well. But the most worrying is that we do not want to have outbreaks or major spread in the schools. So that's therefore the school, the students and the teachers are still need to do daily RAT, rapid tests, and also refrain from going to school if they have any symptoms. 下一題。
Next, the lady in yellow in the front row. Good afternoon, I'm from TVB. Yesterday, there was the 16-month-old girl, and then it was reported that she was in critical condition. I'd like to know her current situation. And what about her mother and grandmother? Are they also positive? And for monkeypox vaccines, how many are you procuring? Will we have sufficient to go around? And what is your assessment of the risk of an outbreak of monkeypox in Hong Kong? Of course, we would have a risk of imported cases. After Hong Kong is a popular place for people to come in, and we have imported cases in neighboring places. But of course, even with some imported cases, we do not want a major outbreak in Hong Kong. And so we will not lower our guards, and we will prevent the spread of monkeypox in Hong Kong. We want to identify them early and treat them, and to arrange for quarantine of close contacts. According to WHO, no massive vaccination against monkeypox is recommended. And our joint scientific committees earlier on had a discussion on under what circumstances should vaccination be done. They have come to a consensus, and the government has discussed with vaccine manufacturers. Hopefully, there can be supply of monkeypox vaccines for Hong Kong reserved for close contacts and high-risk persons. For the 15-month-old baby girl in United Christian Hospital, during the press briefing yesterday, or I only came to know after the press briefing that she had convulsions again. Luckily, after medication, she did not have any convulsion again last night, and her situation is slightly stable. Now, her Glasgow coma index is now 12, 15 being the full score. She had 12, and no intubation is required. And scan did not show any major pathology in her brain or edema. So we're going to do an EEG for her, as well as an MRI. Her condition Now, we should not use the condition of a single patient to stop members of the public from vaccination, because vaccination is very important. It can substantially reduce the development of serious conditions. Even if a fever will not be so high to lead to convulsions or croup or multi-systemic inflammation after contracting COVID. And when more children are admitted to hospital, we have to convert some adult wards to receive children. Now, because we have consistently a low birth rate in Hong Kong, we don't have too many pediatric beds in Hong Kong. If we accept more children into our hospitals, we have to convert some of our adult wards for treating children. That would affect our services, something which we want to see least. So if we can reduce serious conditions and reduce the need for hospitalization, this is not going to happen. We don't want to see the case of convulsion like this child who also need ICU treatment. I think different people are saying to the media that for kids over 6 months old, they should be vaccinated as soon as possible because it takes time. After one shot, protection is not enough, and 3 doses are required, and that takes 4 months. So the more dose a child receives, the better. So if you do the first jab today, then after 3 months, it can get a second jab. You may still hesitate. Please don't. You should get your children vaccinated as soon as possible to prevent unfortunate incidents. Next. The lady in the back row on the right. I'm from cable TV. Now, what is the progress of procurement of BioNTech vaccines for children? Why hasn't we got an agreement? Is it because of the price? And if you can't have a child version of BioNTech vaccines, will that affect the development of the pandemic? Now, there is news that the government wants to do away with hotel quarantine by November. What is your assessment of that? Now, for the 82-year-old man who passed away, I'd like to know whether he was living alone. Did his family member know that he was RAT positive? And for the 72-year-old female, was she living alone? Was her family member aware of her situation? As far as I know, the relevant authorities are now discussing with BioNTech, and progress is smooth. Still, they have to go through the process, and there is no fixed timetable yet. I understand that we are all eager to protect our children. We don't want parents to wait. We want to protect our infants. So as said by Dr. Lau, kids should get vaccinated as soon as possible because one shot is not enough. At least 3 shots are required. And as we tell quarantine, at 9:22 yesterday, there was a press release issued by the government yesterday in response to the issue about hotel quarantine. You can refer to that press release.
On the 82-year-old man who passed away, he lived with his family. I don't know whether his family members were aware, but I think they should be aware because he did a test, and an 82-year-old male living with his family, I'm sure the family members should have the information. But let me remind the public again, if you so unfortunate that you are infected with COVID-19, please remember to report your case to the platform run by the Center for Health Protection. And if you as a family member know that the elderly does not know how to make the report, please help. Because after the case is reported to the platform, elderly people aged above 60 will receive calls from our colleagues, and the colleagues will tell them about the situation in relation to COVID-19 and make an appointment with a doctor and to administer oral drugs to them as soon as possible to reduce the chances of any unfortunate events from happening. The 57-year-old case, maybe Dr. Zhuang can supplement. As far as I know, he tested positive in PCR test, but he didn't report his information to Center for Health Protection. On September 1st, his family members found that he was feeling very unwell and he was slurring. What is his cause of death? We are not sure. And also because he had lung cancer and tumor in his kidney. So we have to, because he passed away at the A&E department, so there'll be a forensic study into his death. So let me say that if you test positive, please make a report as soon as you can. Let me supplement. Just like to tell the public that when you test positive, well, either through RAT. For RAT, if you found that it tests positive, then you should, as soon as you can, go to chp.gov.hk/RATP platform to make a report. You need to upload picture of your own picture and picture of your ID card to receive an isolation order. Some people may try to Google the platform and they may wrongly make the report to a different platform because there are other platforms for people who test positive in PCR test. If the mobile phone number is correct, then the contractor should issue a text to the person informing them that their PCR test is positive and will send them a link for making a report. But that's a link for a different platform, not the platform for RAT tests. And for the other platform, when you make a report, you need to provide the family situation and the people living with you in order for a quarantine order to be issued to the family members. And for the quarantine order, it also includes information that if you were double jabbed and on the 6th and 7th day if you test negative, then you should go to different platform to apply for removal of the red code. So we have received many queries why many days have passed and yet the red code has not been removed and changed to blue. If you have any problems, you can call the hotline 26263066 to make inquiries. Next question. Lady at the back on the left. I'm from Mingpao. For HA, public hospitals, pediatric wards, and PICU, what are their usage rates? How many of the patients in those wards are COVID infected? And now you've got 5,000 COVID patient beds. What percentage is reserved for children? And in public hospitals, would you provide more beds for children? How many of them altogether? And how many children patients have you received so far? And for children's cases, just now, Dr. Lau said that the 15-month-old baby now does not require intubation. But what is her condition now? And can you find also the source of children having blood issues? And also the 7-month-old baby and this female baby, have you found results of their analysis of the variant? By midnight last night, there are 2 cases of 3 to 11-year-olds and under 3-year-old cases who are in critical conditions. Do you have more information about those cases? Are they in serious or critical conditions? on pediatric beds and their usage rates. The usage rate now is about 70%. We don't have a breakdown of which are in intensive care or not. 70% of the pediatric beds now are being used. As for how many beds are reserved for children, it all depends on the trend. If more children are admitted, we have no choice. If children are admitted, we need to provide more beds for them so that they can receive appropriate treatment. But 70% usage rate, well, we won't have 100% usage for all beds. 70 to 80% is considered to be full capacity. Some of the pediatric wards actually or beds are already placed in adult wards. I don't have the actual figures with me, but I want to say that how we can reduce the chances of children being admitted into hospital. The children get sick, of course, we need to look after them. Those who need beds, of course, we would provide them with the beds or open other wards to let the children patients be cared for. The most important is to reduce the number getting admitted into hospital. Well, if you are not infected with COVID, then you won't need to come to hospital. Family members do a good job with precautionary measures, then that will help because most cases virus is brought to the family by family members. But infection rate is quite high in the community. Well, we cannot ensure 100% that we won't be infected. But once you are infected, you don't want the situation to deteriorate. Most important is you need to receive jabs to be vaccinated as soon as you can. Children should, within a short period of time, hopefully they can receive their first jab, then second, third jab. And then we won't need to provide so many beds or adjust our services and also to such an extent that other patients would be affected. There are patients waiting for services, but there's a limit to our number of beds and also our number of staff. So we need to make compromises. I hope that the public can understand that. And for the 15-month-old baby girl, yesterday afternoon, she had some blood issues. This morning, the doctor told us that her problem was treated. And all along, doctors have been carrying out a number of tests. And she is going to go through MRI, EEG, and blood tests to find out what really went on, what caused her early symptoms and situation. We hope that she'll get better as time goes. Right now, she's still in a critical condition. And the 17-month-old baby, right now, he's in a serious condition. Previously, he was in critical condition. Compared to before, so he's made improvement. There's no need for intubation, and neither does he need to rely on respirator. We hope that he can get better and better. Earlier on, we had an MRI on him, and he had an acute brain issue. We hope that as time goes and with medication, he can get better and recover.
On private hospitals, this morning, there were 400 beds in private hospitals, and our utilization rate is up to 85%. As at yesterday, 5 p.m., 316 patients were staying in different private hospitals, and a number of beds available, 400. We will continue to communicate with private hospitals. So far, there are no children beds in private hospitals. We hope that convalescent or recovering patients can be transferred to private hospital beds for treatment. What other questions there were? I can't recall. Speaker was off mic. All right, 2 more. They were classified as serious cases. One is a 3-year-old girl in Eastern Hospital. She had fever and convulsions, tested positive by RAT, and she attended the hospital, and then she was placed in ICU. Her Glasgow Coma Index has always been 15, a full score, and no intubation and oxygen is required. Today, she's been transferred to the general children ward. This 3-year-old girl has never been vaccinated. We do understand because a vaccination program has just started and she didn't have enough time to get all 3 jabs. So for those who have time, you should be vaccinated. Another is a pediatric patient, a 2-year-old girl in Princess Margaret Hospital. She was admitted because of croup and also tested positive. Because of croup, on admission, her blood oxygen level was low. To play safer, she was placed in pediatric ICU. Her condition has improved. No oxygenation is required. She's going to be discharged today. So if the situation is just a short term, and if we've been informed by hospitals that the situation is under control, we will not announce those cases here. The lady at the back, I'm from Orange News. A question for HA. Professor Lau said that it's expected that in November or September, and there may be another 1,000 to 2,000 deaths because of pandemic. Is that too pessimistic? And with regard to the case in the medicine ward of Buddha's Hospital, how serious is the case? And that it seems that there is an outbreak in Zhang Xiutin elderly room. I'd like to know whether all 7 positive patients live on the 5th floor. What is the state of vaccination? You told us that there are 3 stories in that elderly home. Did all staff positive living work for the 5 on the 5th floor? Now, Professor Lau said that the time for BA cases to double would take a few days. And if we do have not have new cases, then does that mean that we can control the pandemic? Now, for the 7 residents and 3 workers affected, they're mainly on the 5th floor. They work or live there. Vaccination rate: 3 employees have 3 jabs. Residents, 5 have had 3 jabs. One shot. 1 no vaccine at all. And what was the other question, please? Dr. Lau. We respect the prediction and views of experts. Professor Lau gave us a prediction of number of deaths. I think the purpose is to see whether we can reduce the number of deaths. And should we do more preparation? It's not just the doctors and nurses should reduce, can lower the number of deaths. Everyone has a part to play how we can minimize infection and serious conditions and hospitalizations. We should all take preventive measures and be fully vaccinated. For those who are over 60 and positive, they should declare as soon as possible so that they can start medication, and then we can lower the number of deaths. And if Professor Lau's projection is here, what can HA do? We have 4 phases of bed motivation. We are now in phase 3. We do not want to activate phase 4 because that means more beds will have to be reserved for COVID patients and more services will be affected. We don't want to see more patients in critical or serious conditions or even death. So we've been given this reminder by Professor Lau, and of course we want him to be wrong. If he's wrong, then the case will not be so, the situation will not be so serious and we'll all be happy. The last question, please repeat your last question. Pass her the microphone, please. Another question for HA, the medicine ward in Buddhist. There are 2 positive patients. Which one is more serious? The one who is 101. And according to Professor Lau, no, BA 2.2, the number of double will 2 to 3 days, but for BA4 or BA5, it takes 7 days to double. How come the latter is more transmissible, but it takes longer for these cases to double? Now we are observing the situation. We see a rising trend, but the rate of increase is not as high as what it was in the 5th wave. Perhaps it was because back then many people were not yet vaccinated, but now we have more people vaccinated and some have had previous infection and so may have some immunity. So the speed of increase now is not as high as what it was in the past, but have we got herd immunity or what? I think this is a scientific issue and we don't know yet. The last question, please. The lady on the left in the last row. I'm from HKET. For serious cases and death, now, do you have the vaccination record for the last 2 cases of death, aged 87 and 90? Now, there are 3 cases of critical or serious cases involving kids. Do you have the subvariance type and what is the CT value and what is the quota of vaccines for monkeypox, and do you have beds reserved for treating such patients? And then there is this guideline from HA for confirmed employees of HA. They can return to work if they are already negative on the 6th day. Are you worried that this will increase the risk of transmission? For isolation facilities of monkeypox, it is still under discussion and we don't have any conclusion yet. The 2 deceased patients, aged 87 and 90 respectively, also with underlying diseases, they both had 3 shots of vaccines. I don't have information on the subvariants with me. Beds, well, it all depends on the number of admissions. If cases of monkeypox have to be admitted, we will reserve beds for them. But right now, most of our beds are now for COVID patients. Of course, if the situation of monkeypox changes, we can always respond and reserve a different number of beds for these cases. Let me give you some figures. As at today, we have 800 odd colleagues who are close contacts because they can return to work after 7 days. So every day we have 100 or so colleagues who can return to work after testing. We have discussed with experts and also CHP. We adopt a very careful approach because PCR test is required. On day 5, a PCR test would be administered and the result must be negative to confirm that the colleague doesn't carry any virus before we allow him to return to his post on day 6. And PCR tests will be conducted on days 6 and 7. And all infection control measures, including wearing of PPE, will still be required. And different PPE requirements for staff taking care of different patients. According to experts, the risk is not too high because we've already done a PCR test and it will be done daily. So it will be implemented and we'll monitor the situation. The press briefing ends here. No, because they are still procuring that and you all want to know the time of arrival. The press briefing ends. The mother and grandmother are stable, no problem. All right, the mother and grandmother are positive. The grandmother was positive before, and then mother and baby were both positive on the day of admission. Speaker was off mic. I don't have that figure. We consider the number of patients occupying the bed.